All right, ladies and gentlemen, how are we doing? So let's get started. Here we have cancer. We shall just look at 4 questions, but then I'll be giving you the tips and tricks on how you can really ace your NXI in NCLEX test. So, number one, a client receiving chemotherapy. Number one, a client has received chemotherapy 2 days a week, every 3 weeks for the past 8 months. The client's current lab values are hemoglobin and hematocrit levels 10.3 and 31 respectively. Daily BC 5.2, neutrophils 50 and platelets 89. Everything is in 1000s except hematocrit and hemoglobin. Which information should nurse teach the client? Select all that apply. Guys, how do we handle the select all that apply? By dealing each statement whether it's true or false according to the question. Number one, use an electric razor when shaving. What do you think, guys? Yeah, this is absolutely true. You need to use an electric shaver because this will minimize bleeding instead of just using a normal razor blade or a manual shaver. So you gotta use an electric shaver to minimize bleeding. Since this client it has what we call thrombocytopenia, the normal platelets is 100k, this one is 89k, so you gotta pay attention to that. Number two, avoid individuals with colds or other infections. What do you guys think? No, false. So here daily BC is 5.2, the normal is 5 to 10, so 5.2 is absolutely okay. Number three, be careful when using sharp objects such as scissors. Absolutely, you gotta be careful when using those sharp objects, razor blades, so name it, knives, so what. So we have number one. Number three, then number four, plan for periods of rest to prevent fatigue. No, hematocrit and hemoglobin levels are normal, so there's no need to plan for rest periods to avoid fatigue. Number five, use a soft bristled toothbrush when brushing teeth. No, you gotta use an electric toothbrush. So now answers are number one and number three. Number two, the nurse is preparing to administer morning meds at 9 a.m. on an oncology floor. Which medication should the nurse administer first? Number one, an analgesic to a female client with a headache of 3 on a pain scale. Number two, an antiemetic to a female client who thinks she might become nauseated. Number two, a mucosal barrier agent to male client diagnosed with PUD. Number four, a biologic response modifier to a male client with low RBC count. Alright guys, this was tricky. The answer is number two. Yeah, remember they're asking us which med should the nurse administer first at 9 a.m. Number one, we can see an allergist client to a headache of 3. No, this one can wait. Headache has never killed anyone. Number two, an antemic to a female client who thinks she might be nauseated. Absolutely, this is an emergency compared to the rest, because when you think about this, when the patient vomits, that means they are losing out on electrolytes, fluids. Those are part of the Maslow's hierarchy of needs, so you gotta pay attention to that. ABCs and Maslow's hierarchy of needs. Number three, a mucosal barrier to a male client diagnosed with PUD. Remember, we are now giving at 9 a.m. So giving this mucosal barrier, this patient has already taken breakfast, and you gotta give these mucosal barriers before breakfast, so that would make sense. Number four, a biological response modifier to a male client with low RBCs. This biological response modifier can take weeks, like 10 weeks, like 10 days, 2 days. So this is not an emergency. That means the answer is number two. Number three, the male client receiving plant alkaloid and neoplastic medications for cancer reports to the clinic nurse that he has been so clumsy lately. I can't even pick up a dime. What statement is the nurse's best response? First, before you even answer the question, you have to know what's happening and the condition this patient is experiencing due to these anti-cancer drugs. So let's get started. Number one, this is normal and will resolve when your therapy is complete. Number two, there's no reason to worry about the minor side effects of the drugs. Number three, have you also noticed a difference in your bowel movements? Number four, are you also weak and dizzy when you try to stand up? What do you guys think? Guys, the answer is number three. Have you noticed the difference in your bowel movements? First, this is an neoplastic alkaloid meds for cancer. What are the side effects? This patient is saying he can't even pick up a dime. What are we experiencing here? Right here is experiencing neuropathy. Guys, you have to first know what's happening, which is life threatening. Yeah, when you say this is normal and resolved when your therapy is complete, no way, this is not normal. When those nerves get damaged, it's irreversible. So throw that away. That can't be the nurse's best response. Number two, there's no reason to worry. Never tell patients to worry. Why? Tell the doctor no. Never tell them not to worry. That's not soothing because that's false reassurance. Number three, have you noticed? Oh, absolutely. Have you noticed the difference in your bowel movements? Yes, because neuropathy can also affect the nerves that control the bowel muscles. Number four, I also weak and dizzy when you try to stand up. This is orthostatic hypotension, which is not a side effect of antineoplastic meds. This is side effects of muscle relaxants and CNS depressants or CNS affecting drugs. So meaning the answer is number three. Alright, number four, the client has received the second dose of chemo and is ready for discharge. Which information should the nurse teach the client? Number one, tell the client to notify the HCP of temperature of 100 Fahrenheit, so that's 7.7. Number two, have the client drink dietary supplements 3 times a day. Number three, encourage the client to stay away from all people outside of the home. Number four, apply a continuous ice pack to the IV site. What do you guys think? Alright, ladies and gentlemen, this was so obvious. Number one, tell the client to notify the HCP of a temperature above 100 Fahrenheit, which is at 7.7 degrees Celsius. Guys, this is chemo. What's the side effects of chemo or adverse effects? It causes immunosuppression. Whenever the patient's immune system is suppressed, then you expect high risk of infections. So that means when the patient there reports a fever, please, this is an emergency. Report them there and then to the HCP. Let's look at the rest. Have a drink dietary supplements 3 times a day. This is okay, but this is not urgent. Number three, encourage the client to stay away from all people outside of the home. Guys, what did they tell you? From all. Stay away from inclusives. All. Never. Stay away from those inclusives. Only. Never. All. Always. And the patient can't just stay away from all people because they can't just stay away from family members. Family members, it's fine, but anything that's general, stay away from those answers. Number four, apply a continuous ice pack to the IV site. No, a continuous ice pack will just cause vasoconstriction. So you just use warm packs so that you can allow vasodilation and blood flow. All right, ladies and gentlemen, this marks the end of our cancer. I hope you guys gained something from it. Just a few tips, ladies and gentlemen. Core content is key. The moment you get the core content, then you have to go ahead and you get the tips and strategies on how you can answer these themes. It's questions. First of all, like I always say, ladies and gentlemen, the computer is going to test you. Computer wants you to answer those first questions really perfect because they are knowledgeable questions. The moment you don't answer the first questions, then it's gonna make your exam lengthy, and by the moment you bypass 85, you're gonna feel as though maybe I failed. You see, simply because you made the one mistake of not attempting the first question so well. You have to make sure that those knowledgeable questions you kill them because the computer doesn't know you. So you just introduce You're introducing yourself to it.